Okay, guys, it's nice to be here today with you, and with a big pleasure, I want to represent you my new lecture about the reproductive system. My name is Dr. Borys. Okay, come on, let's in. In this picture, you can see fat inside the uterus with head, body, black, umbilic, right, placenta around. So, what about the genital organs? Genital organs, you know this, right? We have male and female genital organs, reproductive system. In this picture, we uh, watching around the perineum of the male reproductive system, right? Scrotum, you can see penis, anus, right? And the two triangle, urogenital triangle and anal triangle here. It's male body, right? Here might be location of the pubic centers, right? This one, perineum. Okay, what about the male genital organs? We have internal and external genital organs. What about internal? Which glands? It's testes, seminal vessels, prostate, bulbourethral glands. What about spermatic waste? It's epididymis, vas deferens, seminal duct, and ejaculatory duct. And external male genital organs, it's penis and scrotum. Okay, what for we have this genital system, right? Male. It's a secretion of the seminal vessels, prostate glands, and bulbourethral glands together with the sperm make up the semen. The average ejaculation produces about 3 to 4 milliliters of semen and contains from 300 to 500 million spermatozoans. In this picture, it's a sagittal section of the pelvic region in the male body. You can see the urinary bladder, you can see the urethra, right? Uh, Penis, scrotum, the testis, this one, it's epididymis, afferent duct, ductus afferens. Here you have ampulla, right? Seminal vessels. This one, it's prostate glands, bulbourethral glands, and finally behind it will be rectum. This is the same pictures, but from a more schematical, right? You can see the penis one more time, corpus spongiosus, corpus cavernosus, right? This one, this, it's bulb, right? It's this one, it's a prostate glands, prostate. This one, it's a bulbourethral glands. Uh, Here, it's a seminal vessels. This one, it's ductus deferens with ampulla, epididymis, and testis. Epididymis, testis. Okay. What about prostate? This prostate, right? Uh, the function of prostate. It's perforated by the urethra and the ejaculatory duct. Secretion of the parietal seminal vessels provide nutrition for the sperm and help to neutralize vaginal acidity. And secretion of the prostate glands make the sperm mobile and help to neutralize vaginal acidity too. What about the more function of seminal vessels? Seminal vessels actually produce the liquid for sperm, and prostate regulate the leave of spermatozoon. What about the what function of the bulba urethral glands? Um, it's a lubricant of the internal wall of the urethra, because urethra it's a one way for the for which structure urine and sperm. So actually I remember that this was maybe 10 years ago, maybe more, right? uh, I explained some material about the male and female uh, or genital system or urinary system, urogenital system actually, right? And which different about the male and female urethra. So male and female urethra have anatomical structures, anatomical and difference, and physiological. What about anatomical? Uh, anatomical, it's a female urethra, short and wider, short, let's just mean 2-3 centimeters, and in male urethra, it's more longer and narrow, right? Longer because located in the penis, and physiological special features. Uh, in through the female urethra pass uh, just urine, and for the male urethra, urine and sperm. And I explained something great, and more than 30% staying around me, students, and listen me. And I explained this through male urethra pass urine and sperm, but through female urethra only sperm. And everyone around me, everyone said it. Yeah, yeah, correct, Dr. Borys. Yeah, but I hit my mistake, right? And said, I remember, I repeat, that's through male urine and sperm, but through female only sperm. Everyone said it's I correct, right? Nobody hit me, nobody in this moment. Okay, but I said, don't do it, okay? Like my students. Fine. What about this picture? This picture about the testis, right? So you can see the spermatocord. You can see the ductus deferens, epididymis. This one, all of this is epididymis, and scrotum, in which place located testis. Okay. What about testes? The testes are two glandular organs which produce the semen. They are suspended in the scrotum by the spermatic cord. At an early period of fetal life, the testes are contained in the abdominal cavity behind the peritoneum. Before birth, they descend to the inguinal canal, along which they pass with the spermatic cord and emerging in at the subcutaneous inguinal ring descending into the scrotum. So testis goes from the upstairs to the downstairs in the scrotum from the abdominal cavity. The testes are situated in the scrotum and suspended there on the spermatic cord, since like I said the previous time. The spermatic cord, functional spermaticus, follicular spermaticus, consists of the ductus deferens and its arteries and veins, the testicular arteries and veins, lymphatic vessel, and nerves. Okay, so it's a scrotum and it's a testis, right? You can see the seminiferous tubule, septum, lobular, right? Rete testis. You can see epididymis, head, body, tail of epididymis, right? This one, ductus deferens, and the tunica albugans, tunica vaginalis. So, actual testes have 7 covered. 7. This one. Information. The coverings of the testes are the skin, first. Second, tunica dartus. There's 2 forms of scrotum. Next, external spermatic fascia. Another one, spermatic fascia, cremaster muscle, cremasteric fascia, cremaster muscle is fifth. 6. Internal spermatic fascia and tunica vaginalis testis. So 7 codes, and the last one is a closed serous sac, which contains of the 2 layers, parietal and vistral. What about epididymis information? The epididymis consists of the central portion of the body and upper enlarged extremity, the head, and the lower extremity, the tail, which is continuous with the ductus deferens, continuations, connect with ductus deferens. Each lobe consists of from 1 to 3 convoluted seminiferous tubulus and the straight seminiferous tubulus, rectus. The epididymis stores sperm as they grown up, serves as a duct for the passage of sperm from the testes to the seminal duct or ductus deferens. So external surface and frontal surface of the penis, right? So you can see cremaster muscle, right? Inside cremaster muscle, the testicular artery, we have a ductus deferens here, scrotum, epididymis, testis, right? Epididymis, testis. So it's faster on penis, deep penis faster, superficial penis faster, foreskin, right, glans, or percutium, foreskin. Good. So it's a uh, picture, right, of the spermatozoon. You can see head of spermatozoon and tail of spermatozoon. In this place, you can see a lot of mitochondria. Mitochondria. This one it's fourth of spermatozoon, right? Head and tail. Mitochondria. A lot of mitochondria. So it's internal structure of the penis, right? The veins, arteries around the penis, the corpus spongidosus and corpus cavernosus, spongious from corpus spongiosus made this duct and glans penis, right? But corpus cavernosus, it's accumulates of the of that, right? Accumulate blood, and when the one month accumulate their blood vessel, right? Blood in the corpus cavernosus. Sorry, guys. So this one, it's internal structure of the penis. You can see the corpus cavernosus around the deep artery, right? And this one, corpus cavernosus, corpus spongiosus, vessels. Corpus cavernosus become bigger and bigger when the blood goes into this body, into this blood, right? Into the body. And the penis becomes stretch, and it's found its action called erection. When the body ready for sexual contact, right? Good. So what about the female genital organs? You can see female genital organs. It's a perineum of female. Pubis, right? It's a erima pudendi. Small lips, big lips, urethral orifice, vestibulum, right? clitoris, anus, hymen. It's just virgin have this structure. Okay, and it's a glands, para-urethral glands, greater vestibular glands, just vestibular glands, right? Clitoris, vagina orifice here. Okay, some information about that in general. Which female genital organs you know? We have an internal female genital organ and external. Internal, it's a ovaries, uterine tubes, right? Or fallopian tubes, uterus and vagina. And what about external female genital organs? It's mons pubis, labia pudenda majora, labia pudenda minora, glandula vestibularis majoris Bartolini, clitoris, and bulbus vestibuli. Okay, sagittal section of the female pelvic region. You can see pretty good the uterine tubes, right? Ovarian, this one, uterus, the cervix uterus, the cavities inside uterus, right? The urinary bladder, urethra, vagina, rectum, anus, right? Labium minor, labium minor. And this one, it's a pubicum, mons pubic. This one, mons pubic. Okay, what about vagina? It's situated behind the bladder and in front of the rectum. It's a muscle-lined tubes, 8-10 centimeters in length, and that it's a site where sperm cells from the penis are deposited during sexual contact, the exit points for the menstrual flow, and the birth canal for the baby during childbirth. What about glandular vestibularis malaris, Bartholin glands, or greater vestibular glands? Are the same of the bulbourethral glands in the male. Become this labium and entry inside the vagina, mostly lumbrican, right? They consist of the two small round bodies situated one on either side of the vaginal orifice. Each gland opened by a means of the duct about 2 centimeters long, immediately lateral to the human, in the groove between it and the labium minus. So this one picture pretty good visible the uterus, right? Uterus, the cervix of uterus, and vagina. This one it's a fallopian tubes and fimbria, ovarium. Information about in this picture about the ligaments. It's cardiac ligaments here, urosacral ligaments, the broad ligaments, suspensorial ligaments which fix this organ inside the pelvic region. What about uterus? Uterus, hysterometra, is a hollow, thick-walled muscular organ situated between the bladder and rectum. Into its upper part, the uterine tubes open, one on either side, while below its cavity communicates with that of the vagina. The uterus is composed of three cords: an external or serous perimetrium, a middle or muscular neometrium, and an internal or mucous endometrium. The inner link of the uterus is the endometrium, which is built up every month in preparation for the possible pregnancy. The endometrium is composed of two layers, the stratum functional and stratum basilaris. Every month, in response to estrogen secretion, the endometrium is built up in preparation for the possible implantation, like I said previously, of a fertilized ovum. If pregnancy does not occur, the endometrium is shed together with the blood and glandular secretion through the cervical canal and vagina in the monthly process of menstruation. So this one, it's uterus and a part of vagina, round ligaments, suspensory ligaments. So here, infundibulum ampulla, it's a fimbriae, it's a fallopian tubes, right? What about position of the uterus? You can see, right? Uterus, this one, uterus, can have a lot of different position, The form, size, and situation of the uterus vary at different from period of life. So first, in the fetus and infant, the uterus is contains of in the abdominal cavity, projection below the superior aperture of the pelvic. Second, information. At puberty, the uterus is piriform in shape and weight 40-70 grams. The fundus being just below the level of the superior aperture of the pelvic cavity. Okay, next. The position of the uterus in the adult is liable to considerable variables. When the bladder is empty, the fundus of the uterus is directly forward while its anterior surface forward and downward. Anteroversion. The uterus being flexed forward to the cervix form with the angle open forward. Anteflexion. In distending of the bladder, the uterus may be inclined backward. Retroversion. Backward flexion of the uterus, it's a retroflexion, is a pathological condition. Another situation, another information, form, right? And this location. During menstruation, this organ, uterus, is enlarged, more vascular, and its superface rounded. The internal orifice is rounded, its labella swelled, and the lymph membrane of the body thickened, softer, and of a darker color. During pregnancy, the uterus becomes enlarged, and in the eight, uh, 8 months, reach the apical region and weighs 2 kilograms. The increase of size is partly due to growth to the muscle myometrium and partly to development of new fibers. After childbirth, the uterus nearly regains and usual size, regenerates, right? Weighing about 40-50 grams, but its cavity is larger than in the virgin state. Stay larger, right? And finally, in old age, the uterus becomes atrophied and pale and denser in texture, and the external orifice of the uterus is obliterated, while the lips almost entirely disappear. So, in this picture, you can see the blood supply, right, from the common iliac artery. You can see, right, ovarian artery, the blood supply, the ovarium, the fallopian tubes, and the vaginal arteries and uterine arteries. Vaginal arteries is blood supply from another part of the arterial system. It's an internal iliac artery. All information about this, more details, you can watch in my previous lecture about the arterial system of the body. Arterial system. What about ovary? Ovary or ovarium is the same with the testes in the male body. Ovary produce the ova and the female sex hormone. They are two nodular bodies situated on either side of the uterus in the relation to the lateral wall of the pelvis. The centers of hormone produced in the ovaries are the follicles, which are always present in various stages of development. Semicolor ovarian follicle secreted estrogen and are almost ready to release an ovum in the monthly process called ovulation. After grown up, ovum is discharged from the ruptured follicle. The follicle becomes the corpus luteum and temporary endocrine glands that secreted progesterone and relaxin. This one, all the information which I give it to you now, it's visible in this picture. So it's ligaments, suspensor ligaments, right? This one is oval ligaments, fimbriae of the uh, fallopian tubes, right? So the progress of the ova, right? It's ovulation, and ova goes into the fallopian tubes, right? Goes into the uterus and return back, and in the fallopian tubes have happen of fertilization. Fertilization joins um, over with the testes, right? If the fertilization not happen, so um, the ovulated eggs, right, become corpus luteum, right, and after this, it's corpus albicans, and disappear, right, in this place. Um, which hormone produced by female genital organs? It will be before ovulation. It will be estrogen, estrogens. It will be estrone, estriol, and estradiol. And after ovulation, it will be hormone to protect pregnancy. It will be progesterone. And what about the mama glands? Mama glands. So you can see the nipple, right? Lactiferous sinus, right? Lactiferous duct, suspensor ligaments. So what about these organs? Mama glands is accessory of the reproductive system and it functions since the secretion milk for infant. The mama consists of the gland's tissue, of fibrous tissue connecting its lobes, and of fatty tissue in the intervals between the lobes. Each mammal gland is composed of the 15 to 20 lobes of compound areolar glands that radiate out from the nipple. The ducts from many glands coalesce into larger ducts. Milk is stored in the lactiferous sinus. The pigmental area around the nipple is the areola. The actual milk-producing hormones is prolactin. Area, areola, right, nipple. So, lactiferous sinus, lead the milk in this place, right? Milk for baby, for newborn baby. Lobes, lobulus, and this one suspends our ligaments. Suspends our ligaments. Okay, when that happens, ovulation, it's in middle of the menstrual cycle. Its menstrual cycle can be prolonged from 21 till 40 days. So ovulation in the middle, it will be in the middle. If it's 25 days, for example, it will be 30, 13 days, right? If it will be 35 days, for example, it will be 70 days, right? Or 80 days ovulation. Menstruation, bleeding from the vagina with its blood with endometrium, uh, prolong how many days? 5 or 6 days. And in the norm, the female, the woman or girl must feel nothing, uh, must have no feel the pain when the bleeding happens, right? With the care, prolonged menstrual cycle in the norm, and for one menstruation, extraction how many? Near 200 milliliters of the blood, and this blood, mm, in this blood, menstrual blood, located to many ferments. Uh, mm, how many times can leave spermatozoon inside inside the female reproductive system, inside female internal genital organs? Near 2 days, spermatozoon can live inside. So eggs or ova inside um, female body can live 2 days too, plus minus. So the ovulation and fertilization can happen. It must be the middle of the menstrual cycle, and plus minus 2 days, and 2 days before and 2 days after. So its period for ovulation give it, doctors give it seems like from 5 to 6 days around it for all of this ovulation. It's time when can happens fertilization. The rest time of the menstrual cycles, it's can happens, but have not so many chance, right? No, things like this. And what about the developed of the internal organs? Female body, you can see the from 8 9 weeks female fetus, and at birth you can see ovary, uterus, right, the vagina, everything. And this one, it's developed of the internal external genital organs. Actually, it's this one, this glands anus, right? This from urogenital folds. It will be from this, from glands developed glands clitoridis, from these folds developed the labia major and labia minor. urethral orifice. You can see in vagina orifice, right? In this place, it must be human. It's connective tissue. It's closed. The vagina orifice in the virgin, just in the virgin. Okay, and this one is developed of the mm, genital organs, but male body. You can see 7 months, 8 months, and this one in infant, 1 month old infant. Uh, Pretty good. Can you can see the moving of the testes, right, from the abdominal part through the inguinal canal and into the scrotum. So in inguinal canal located in the female body around ligaments of uterus, but in the male body spermatic cord. You can see the spermatic cord. And this it's one more time the general tablets which included all information about the which internal and external genital organs, male and female body have. So one more time, for male body, external it will be penis and scrotum, right? And internal it will be testes, will produce the spermatozoon and which hormone? Testosterone, epididymis, right? Ductus deferens, seminal vessel, prostate, and bulba urethral glands. So what about female body? Female body external. It will be mons pubis, and the labrum major, labrum minor, clitoris, the center of sexual feeling, right? Uh, okay, vagina, orifice, the clitoris, sexual pleasure, vagina, orifice, vestibular bulb, vestibular glands, and para-urethral glands. Okay, female. And what about the internal? It will be ovarium, uterine tubes, uterus, and vagina. So, guys, it's a really big pleasure was for me give it to you all this information which I know from my knowledge give it to you, and I hope that my knowledge give it there more information and help you for your study this topic, this really one of the biggest and one of the necessary parts of the normal anatomy. So I wish you the good luck. I wish you good health. So have a nice time and till until for next meeting. Bye guys. Bye.